it's perfectly fine. You can start introducing yourself.
Brilliant. Hi, everybody. So my name's Leanne Summers, and I work within the NHS in England. The NHS is a sort of single payer insurer. It stands for National Health Service, and we provide health and social care, well, health care free at the point of use, for the nation within England, and as part of the Department of Health and Social Care, we are bringing, looking at policies to extend our services, sort of around social care mechanisms too, and looking at how we can, sort of address health inequalities and deliver, all of the services to our nation. So I'm working on the AI strategy within health and care as part of the NHS Transformation Directorate. So recently the transformation, we've just formed a transformation directorate, which shows kind of where we are in our digital transformation maturity, because sort of all of our digital units have actually merged under one header, which is, transformation. So it feels as though we're definitely on the way there. So I've got the unenviable task of delivering a strategy for AI within sort of this health and care system, of which we're at various different stages of digital maturity, but there are areas there's a lot of advances within this technology space, and I'm just sort of here today to talk to you about what we're thinking of doing in order to support developing a learning health and social care system for a nation. Is that okay, Muzim? Should I just go ahead now as well?
Yes, all fine.
Yeah, brilliant. Okay, cool. So
just keep in mind, my English is not that good, so imagine there are many like me there. To slow down a bit. Thanks a lot.
Thank you. Okay, great. So as I said, working on a strategy for the use of AI technologies within our health and care sector. So I'm going to be able to move here we go. Great. So we are developing a vision. So we are using sort of for our strategic objective setting, we're using kind of the VMOS framework. So looking at setting a vision, some missions underneath the vision, and then sort of strategies or objective strategies and tactics. So this is going to be something that's evolving over time. We're looking to develop a roadmap and sort of incrementally support the wider adoption of these technologies within health and care. We want to do a technology strategy that supports the wider objectives of our health and care system. So it's something that, it's not us doing technology, for the sake of technology. It's actually us supporting, the wider vision around how we deliver services for our nation, enabled by those technologies, with a real focus on how we support better outcomes. We use the notion of a learning health and social care system because, as I sort of said, we are the insurers as well as the delivery mechanism for our health and care services. So at the moment, we're not really as data informed as we could be, and so therefore we're not necessarily using sort of advances with machine learning and the like that can support us with better commissioning decisions or resource allocation, or sort of like looking into our supply chains and HR. So the scale at which we're working is massive, and so we're looking at how do we become a bit more dynamic? How can we enable these personalized intervention? How can we look at prevention more rather than solely focus on treatment? And ultimately these technologies can support us in being more data driven. So this is a very busy slide, and you'll see I've got draft written all over this because we're working it up. So the idea of coming to present to people like yourself here today is for us to get engagement. So I really really support questions and things like that within the chat. So we within the NHS have had an AI lab for the last few years. This has put some significant investments into the creation of evidence to support the wider adoption of AI technologies that are sort of in development. One of the things that we know in order to get sort of better engagement from clinical staff in particular is obviously looking at whether or not the products themselves are efficacious, if they're safe. And we're sort of following a similar pathway as the drug development cycle. So we've got different phases of the award. Depending on the maturity of the technology, you're either sort of lab, on the bench being tested and validated, or you're a product which is actually being tested in live clinical environments. Significant investments have been made there, and we're already having an impact on sort of more than 80,000 patients, which is really significant. So it's a live, living, breathing laboratory that we've got to learn about some of the wider challenges and issues into the sort of adoption of health and care, of AI and within health and care. We partner with the Office of AI, so they are setting our kind of the wider strategic direction for AI technologies sort of out of health and care, and they launched a national strategy for AI within the UK in about September of last year. So this is a really industrial strategy, and it's looking at sort of, how we invest in workforce training, thinking about the, the presentation that a colleague was making just before. This is a really, having people that are trained in these technologies is crucial. So as a country, that's a big drive for us. And we're looking at the ways in which we can upskill our workforce within health as well to support sort of on this national, sort of national priority that we've set within the UK. We've got kind of a digital estate within the NHS. We've been doing technology, for years now. EPRs, electronic health records, that sort of thing are ubiquitous within our primary care estate. It's not quite the same within the acute sector, but it's getting there, and lots of investment has happened over the last few years on an agenda which was at the time digitize, connect, transform. This is kind of morphing a bit at the moment as we look into what we do with our long-term plan moving forward. But essentially, digitize is, do we have the technology? Connect, does it talk to each other? And transform is sort of what we do then, in order to transform pathways of care. That was linked to sort of a more recent policy paper, sort of about 2018, that looked at the vision for digital data and technology in health and care, and used principles such as better user research, interoperability, safety, and cyber as like really, really important principles in moving forward. So this is sort of the ecosystem we've got over here that we're working with. So we've got this living laboratory. Recently, the G7 has committed to working together on sort of the wider regulations of AI as medical devices. So last year the policies were sort of set across the G7. So so this is sort of our operating environment. There is a data strategy coming from the NHS. This should be launched sort of over the summer, we hope. And then the AI strategy that I'm leading on, it will be an abstraction of the data strategy. So, what threads can we pull from data to actually, do things with that data that supports in developing this sort of, as I said, this learning health and care system. So, so that's the landscape that we're working in. When we're doing an analysis, what should we be doing for AI in health and care? We've still got a lot of questions. The vision sort of looks out to 2030. What can we be doing? So we've got wider adoption of the technologies, but the analysis have shown us, sort of what problems are we going to have to overcome in order to develop a strategy that's meaningful within, sort of within our sector. So these are some of the gaps that we've identified. We obviously have some big hurdles with regards to public perception around these technologies. The Centre for Data Ethics and Innovation, CDEI, I can always get the acronyms a little bit wrong, but the Centre for Innovation they're looking at, or they've just published a barometer of public perceptions around the use of data in government, and then, you know, sort of an extension of that is around AI. And the word cloud was quite clear. You know, the public are still a little bit concerned around, you know, what AI means more generally. It's interesting, obviously, because, you know, we use machine learning technologies and the like in a lot of our daily lives. And of course, you know, you've been talking about this at great length across the conference. So to what extent do we need to provide sort of training, education, and also assurance? So, you know, what governance mechanisms do we have around that mean that we can show to the public that these technologies are being used responsibly, safely, and, you know, that they won't introduce harm or exacerbate inequalities that we may already observe within health. So, you know, there's a lot of work to do there in moving AI away from, you know, sort of this notion of robots to actually technology that we're routinely using to support better decision making. We have some, you know, big questions around data quality. You know, so much of the data is you know, sort of free text in care plans and, you know, reporting within EPRs. Does it need to be standardized? We are looking at interoperability protocols. So, you know, sort of where we can share, you know, medicines database, medicines information. We've obviously seen a lot of data sharing within things like vaccines over the pandemic as well, in common sort of like for direct care interventions, and that's sort of standardized. But, you know, can we be using natural language processing and the like to actually support in analyzing the data that we've got that's more free text? We're really interested as well in some of the technologies that are kind of augmenting how, you know, how data is captured. So if that be by voice and codifying it that way, or codifying as people are typing into computer screens. So, you know, sort of what can we be doing at the data entry point? And this is a big theme that we have within the strategy as well, around like sort of looking at the usability of our software estate, you know, for data capture, and how we're making sure we're not introducing additional burden to the, you know, the people that are just trying to deliver, you know, brilliant health and care services to the nation. So yeah, data quality is a big kind of a big red herring, and a lot of our time with our data scientists at the moment, when they're trying to implement IT, you know, AI projects, is just cleaning data, you know, marking it, coding it up, that sort of thing, so that it's actually able to be used. So we've got some work to do there. We also have, you know, so a lot of you know, these technologies are being trained on sort of static data sets, but, you know, when this is deployed, if you're a clinical intervention tool, what happens when that's deployed sort of on live data? We've seen some papers in the last year looking at kind of data drift and things that happens once the technology is implemented, and so how do we actually mitigate for that, or how do we test enough at, you know, at scale, you know, what the implications are for the technologies as they go live. How am I doing for time?
Yes, we have 10 minutes. Keep 5 minutes for Q&A, please.
Yeah, cool, brilliant. And then so, sorry, because I can't see on my screen, I can't see the time. We also have, so our commercial and regulatory pathways for these technologies are relatively immature. So, you know, we need to progress those. And we're concerned as well around things such as, you know, if we create, so we may replace, well, we're not replacing, but, you know, we may supplement the workforce, you know, tasks that are being completed. Maybe we can support in gaps we have in sort of radiology by providing a second reader. But, you know, sort of do we create another workforce gap there where actually we don't have the skills necessary in order to run and maintain these technologies at scale? So, you know, we have to make sure that we're not just creating more problems. And, you know, also there's a big inequity in digital maturity across our estate. So, you know, some of our centres are, you know, using, you know, a supplier agnostic, but, you know, sort of NVIDIA chips and whatnot to make sure that, you know, we can deploy things for the imaging platforms at scale. But then there are other areas where, as I sort of said, our acute sector may still be on paper. So, you know, if we are deploying a technology at scale that can support in transforming a pathway, you know, what does that really mean if it's not then distributed evenly? So this is the approach that we are working through. As I sort of said, it will be iterative. We want to build on this and you know, sort of it will evolve over time. But essentially, as I sort of said, the vision is looking at building this learning health and social care system. And then we're going to work under 2 discovery missions to address the challenges that we've previously identified. So one on data readiness. This is looking at things like data quality. It's looking at the navigableness of the data set. So, you know, if you're coming in and you would like to, you know, provide a service to the NHS, you know, that can support in delivering better health outcomes, how do you even know which data sets we've got for our population, and you know, what do you do to access those? So we're also looking at access control mechanisms and whether or not we can, you know, if there's a need to professionalize the workforce to make access to these things easier. The Gold Acre Review has just been launched in the UK. I encourage you all to have a look at that. It looks at some of the kind of, you know, what we might need to do for data science, you know, across our estate. So it plays very much into this theme. We have a pathway optimization mission as well, which turns the kind of question on its head. So if we're looking at data readiness on pathway optimization, it's more about what actual need of the system are we supporting. So if there's a quality improvement pathway happening down a diabetes pathway, for instance, are we routinely including data scientists in that in such a way that means that we're not designing out approaches for ML and AI in the future? So these 2 missions will work together, and, you know, if successful, we will then, you know, sort of look at the wider deployment and scaling. So some of the AI lab products already are within this sort of scaling kind of approach. So, you know, we're very sort of more mature with opportunities for imaging, you know, sort of imaging technologies. So we'll be looking at sort of validation and the like, and how do we actually, you know, provide the equitable delivery. And we're also engaging across the different regulators to make sure that, you know, we're pushing the boundaries of the regulation to make sure that it's really up to date, and providing clear route for innovators sort of to come into that space. So, you know, pharma and the pharma sector obviously feeding into this too. And we'll be looking at the commercial pathways as well, you know, to make sure that that's being addressed. So these are, we've got public engagement as well, all baked into everything that we're doing, and that's with colleagues in the data strategy. So I may just leave it there today, but so that we've got some questions. I think I'll just leave my sort of my details here. If anyone's interested in the work that we're doing, we encourage you to get involved in our virtual hub. So this is it's a hub where you can actually just ask questions and sort of come in and get involved. And as I said, the strategy itself is in development. So we're hoping to publish at some stage this year, but as it's a roadmap based strategy, it will continue to iterate. So as we learn more about the data access controls or the pathways that we genuinely need supporting, you know, and what the ML AI requirements for that might be, we'll make sure that that's available to everybody so that you can understand, you know, sort of where you can add most value. Thanks very much.
Thanks a lot for this insightful, interesting presentation, Leanne. Thank you. You got you had a very nice presentation. We loved it. Just I'm waiting for participants to have questions. We have still 4 minutes. So if anybody has a question, just write it in the chat area. We give you a microphone, or we can read the question. Any question before I obligatory choose somebody to ask a question?
stunned everybody into silence.
I'm just waiting to see if somebody has a question. So Chiara is asking from MSD on the chat area. Do you have some example of already active projects?
Yeah, so I'll put a link in the chat onto our website where we've got examples of the technologies that are already being tested within the NHS. So we've got products that are looking at sort of as I was sort of talking about, you know, as people are entering into an EPR, it's adding, you know, sort of code directly to the it's codifying the information as it's being typed in. We've got various different pathways looking at stroke, looking at kidney factors. There's lots happening on breast imaging. You know, there's a whole myriad of different things. But yeah, the website itself is perhaps the best place to go and dig into if you're more interested in that. And as I said, get involved in the hub because it's a community. This is an evolving technology, right? So we're all learning as we go.
Thanks a lot. Thank you so much. So now Vladimir has a question from Amgen UK. Wait a second. Vladimir, I give you microphone. I didn't get the point. Okay, Vladimir, go ahead. You have a microphone.
Yes. Hello, Leanne. Thank you very much for nice presentation. In relation to my talk, of course, do you use some models for predicting enrollment of patients, or also probably event counts in event-driven trials like oncology, cardiovascular? Thank you.
Yeah, so we definitely, so we're not necessarily doing it for clinical trials ourselves as the NHS. Obviously, partners are working, you know, sort of on clinical trials themselves to come into the NHS, but we are looking at things like bed management. So as people come into the, you know, the NHS acute setting, we've looked at technologies that are sort of like triaging patients whether or not on their COVID status, and then allocating, you know, sort of allocating roles there. I've also got ones on bed management looking at risk stratification. So, you know, who might be eligible for, you know, like a proper comprehensive review of their stay, and then, you know, allocating them out into sort of like the social care sector or back home with the adequate support. So it's kind of like analyzing who we've got in our hospitals and, you know, how we manage the beds and that kind of thing. So our Skunk Works team are doing lots of work on that. So again, I encourage you to link through to the website, which I've just put in the chat, so that you can have a look at a little bit more on the details of that. We also publish all of the code that we have on GitHub. So if anyone's interested in learning about some of the early stage experiments that we've been doing, you're very welcome to.
Okay,
Thanks
thank
a
you very
lot.
much. Thank you.
Thank you. So very insightful as well. Marcin said that brilliant presentation. The feedback's on the chat area. You can see that. Zorana Iraq from Roche is saying many thanks, Leanne, for giving us perspective from the other side of pharma.